When you get a diagnosis of type 2 diabetes, there's probably one big question that pops right into your head. Do I have to take insulin? Well, in this explainer, we're going to dive into the huge range of really effective treatments that come way before that step, so you can feel confident and in control of your health.
So let's just get right to it. This is the #1 question, isn't it? And it's often the biggest fear. I mean, the whole idea of daily injections can feel pretty overwhelming. But is it really a sure thing? Is that where this road always leads?
And I've got some great news for you. For a lot of people with type 2 diabetes, the answer is a big, loud no. You see, insulin is just one tool in the toolbox, and it's usually not the first one your doctor is going to reach for. There's this whole pathway of other options to explore first, and that's exactly what we're about to walk through together.
So here's our game plan. We're going to start with the most powerful foundation of all, your lifestyle. Then we'll get into the many different oral medications that are often the next step. After that, we'll even look at other medical options. And finally, we'll talk about the most important part, how you and your doctor team up to navigate this journey and build a plan that's perfect for you.
All right, let's kick things off with part 1, lifestyle. And I really can't stress this enough. This is the absolute cornerstone of any management plan. Why? Because this is the area where you have the most direct control. The changes you make here can have a huge impact right from day one.
So, what's actually in this lifestyle toolkit? Well, it's really about looking at the whole picture. It starts with a well-balanced diet, of course. Then you've got getting your heart rate up. We're talking about 30 minutes of aerobic exercise, like a brisk walk 5 times a week, plus a couple of muscle strengthening sessions. But it's also about things we sometimes forget, like making sure you get enough good quality sleep. And for some, a weight loss plan might be part of it. Oh, and a big one, avoiding tobacco. For some people, just making these changes is enough to get their blood sugar right where it needs to be.
Okay, so what happens when those lifestyle changes just aren't quite enough on their own? Well, the next step is usually an oral medication. Now, it's super important to not see this as some kind of failure or setback. Think of these as just another powerful set of tools to help you out.
Now check this out. It might actually surprise you to learn that there are 9, that's right, 9 major classes of oral medications for type 2 diabetes. Just think about that for a second. That number alone tells you just how far treatment has come. This is not a one-size-fits-all situation anymore. It's all about finding the exact right tool for your body.
Don't worry, you absolutely do not need to memorize these names. The real takeaway here is just how many options there are. See, each of these classes works a little differently inside your body. Some help your pancreas put out a bit more insulin. Others help your body use the insulin it already has more efficiently. And that's why your doctor might try one, or maybe even a combination of a couple of them, to find what works best for you. It's all about personalizing your plan.
But what if you've made the lifestyle changes and you're trying the oral medications, but things still aren't quite right? Well, that brings us to our third section, some of the other medical options out there. These are just the next steps in that journey to really manage your health well.
Now, this is a really important point. The word injectable does not always mean insulin. There are other non-insulin injectable medications, like a class of drugs you may have heard of called GLP-1 agonists. You can think of them as helpers that give your body a little nudge to release its own insulin at just the right time, like right after a meal. This helps keep your blood sugar from spiking. And for some people who meet the criteria for obesity, bariatric surgery can be another really powerful path to improving blood sugar levels.
So, with all these different tools and options, how in the world do you manage it all? Well, that brings us to section 4, navigating your treatment plan. And this is all about the partnership between you and your healthcare team. You are the expert on your body and your life, and they're the expert on the medicine. And together, you figure out the best path forward.
Of course, anytime we talk about medication, a totally natural question comes up. What about side effects? That's a completely valid thing to wonder about, so let's talk about how you and your doctor handle that.
The approach here is all about teamwork. First things first, and this is really important, if you think you're having a side effect, you call your doctor. Don't just stop taking something on your own. Then you'll work together, like detectives, to figure out what's really going on. And from there, your doctor can adjust the plan, maybe tweak the dose, maybe switch you to a different medication to make sure you feel good.
You know, it's also super important to remember that your treatment plan isn't carved in stone. Our bodies change, our needs change. So what works perfectly for you today might need a little tune-up in a year or even 5 years from now. And that is completely 100% normal. Just think of your plan as a living document that you and your doctor get to review and update together as you go. Which brings us right to our final section,
the big takeaway. Honestly, if you remember just one thing from all this, I hope it's this. This whole thing is about creating a proactive, personalized partnership for your health.
And, our source material at Healthline just says it perfectly here. Your doctor is your guide. They're there to help you make sense of all these options we've just been talking about and to work with you to build a plan that actually fits your life and helps you reach your goals. So let's circle all the way back to where we started. The most crucial point, the headline of this whole explainer, is that a type 2 diabetes diagnosis does not automatically equal insulin. There is a deep and diverse toolkit, everything from lifestyle changes to a whole bunch of different medications that can help you manage your health really, really effectively.
And that just leaves us with one final thought. Now that you're armed with all this information, what's your next step? What's the very first question you're going to ask your doctor to start building that personalized plan just for you?